Apraxia of speech is a speech disorder that makes it hard for people to say what they want to say, even when they know the exact words. It's not about weak muscles or lack of effort, it's about the brain having trouble planning and sending the right messages to the mouth. Let's break it down step by step. When we speak, the brain creates a plan for how our lips, tongue, and jaw should move to make sounds. In apraxia of speech, the region of the brain responsible for motor planning, which is located in the left frontal lobe near the Broca's area, has difficulty generating accurate movement sequences for speech. The individual's language comprehension and cognition remain intact, but the brain cannot consistently send clear, organized instructions to the speech muscles. As a result, speech may include articulation errors, inconsistent sound substitutions or omissions, and difficulty initiating words or phrases. For example, a person might attempt to say coffee, but produce something like toffee or foffy, showing variability across attempts. Apraxia of speech can happen to adults after a stroke, brain injury, or tumor, or sometimes with degenerative diseases that affect the brain. There's also childhood apraxia of speech, which is similar but happens as the child develops. It's not caused by an injury. Children with apraxia often know what they want to say, but struggle to get words out clearly. Their errors change from one word to another, and longer words are usually harder. In both adults and children, the issue is the same. The brain's motor plan for speech isn't clear or consistent. Speech pathologists are the professionals who test and treat apraxia. They start with an oral exam to check that the muscles work properly. This helps rule out muscle weakness. Then they use speech tasks. For example, saying putaka in sequence, which tests how well the brain can plan and switch movements. People with apraxia usually struggle with this. The speech pathologist also listens for inconsistent errors, groping movements, and changes in prosody, which is the rhythm and melody of speech. They also test whether language comprehension is intact to make sure that there is no aphasia. Treatment for apraxia focuses on helping the brain relearn how to plan speech movements. Therapy is intensive and repetitive. Lots of practice saying sounds, syllables, and words in the right order. Speech pathologists often use visual cues like watching mouth shapes, tactile cues like feeling how the mouth moves, and a slowed speech rate to help build accuracy. Family support is also very important. Practicing words and phrases at home help the brain strengthen new motor patterns. Oftentimes, with consistent practice, people with apraxia can make amazing progress. Apraxia speech can be challenging, but it's important to remember it's not about intelligence or motivation. The person knows exactly what they want to say. Their brain just needs help strengthening the pathways to make speech possible. With patience, support, and speech therapy, people with apraxia can improve their communication and confidence. Thanks for watching, and remember, communication is always worth the effort.